Yeah, semaglutide is certainly advertised like candy right now. It's why it's really important for you to be selective with what office you want to go to and who you want treating you. You will see a provider every time you come in for your semaglutide check-in. We watch you on a more physiologic level by monitoring your skeletal muscle mass closely. We're far less concerned about what the scale says in terms of just, oh, you lost 5 pounds. And we're way more concerned with, where did that 5 pounds come from? Did you just lose 5 pounds of muscle mass? Are we trending that? Are we checking on that? Or did you lose 5 pounds of fat? Because that's going to be really important. You don't want to go lose weight and lose all your skeletal muscle mass and still have this fat, because that's what causes inflammation. That's what makes you feel sluggish. That's what causes fatigue and cardiovascular trouble and increases your risk of diabetes and cancers. We want to decrease the fat and we want to keep your skeletal muscle mass. So when we check in with patients and look at their in-body scan, the first thing my eyes go to is their skeletal muscle mass. If it's dipped or dropped, and sometimes it may drop a pound or two and we're not that concerned, but if it starts to trend beyond that with each visit, then I'm saying, okay, we need to get aggressive. We're gonna start you on maybe a creatine powder with some amino acids. We need to increase your protein intake to over 90 grams of protein in a month. Now that number will vary based on the size and the gender of my patient. At least for, I would say my typical patient is between 30 and 60 years old and is a female. And most of those patients, I just want them on at least 90 grams of protein every day. And if they're not keeping track of it, they need to be. And oftentimes they're not getting that in their diet. So on top of the creatine and the amino acids, we're giving them like a whey protein powder or a pea protein, if they want to go the vegan route. But there are certainly ways that we can make sure we don't lose that skeletal muscle mass. But patients who come in with a average or below average skeletal muscle mass are even more at risk of losing that skeletal muscle, which is why it's really important we are aggressive right away rather than waiting.